Hi, everyone. So today's episode is on veterans' mental health. We are really excited to have a guest expert, Dr. Stephen Sayers, who's a professor at the University of Pennsylvania and also has an appointment at the VA. And through the VA, he has a program called Coaching into Care that helps people get their loved veterans into treatment, which is so important because the military doesn't always promote mental health the way maybe we would like it to. And, it's pretty clear that being a veteran comes with some massive mental health challenges at times, anywhere from PTSD to difficulty reintegrating back into society, to getting home and like their whole role has changed because their family has changed in the interim. So we're really lucky to have Dr. Sayers explain all of that to us and also kind of let us know what programs the Veterans Affairs has in general. The VA is a really great place for psychologists and mental health workers to work because they have a ton of programs actually meant to help veterans. So there's a lot of resources there. The VA is amazing. He'll talk more about that. And I just, I was excited to do an episode on this because veterans deserve so much of our respect. They sacrifice so much for us, and it's really great knowing what resources there are out there. And what I really love about Dr. Sayers is that he shows us how to have a conversation with our veteran loved ones to help them get treatment, what to say and what not to say. So it's a really helpful episode. I'm really excited for it, and I'll let the episode play now. Thanks. So Kibby and I are so lucky to have Dr. Stephen Sayers join us today. He is the director of Coaching into Care, which is a Veterans Affairs program for family members concerned about a veteran. He's also associate professor at the University of Pennsylvania in the Department of Psychiatry. So welcome. Tell us a little bit about yourself and the program.
I'm really happy to be here. Thanks for inviting me. I'd love to talk about coaching into care. I think we started our work way back in 2008 or 2009 with the recognition that there's lots of veterans, just like civilians who are a bit reluctant to seek mental health care when they need it. So we really understood that family members play a key role in identifying when folks are really struggling, and family members really struggle with what to do. So our role in the program is really to talk with family members who call us with the concern about their veteran and how they're doing and how they're adjusting to civilian life. And we work with them about having a conversation about their concerns directly with the veteran. We are advocates of the family members and also work with friends of veterans, but we are their advocates and their coaches, and they do the work of talking with the veteran about seeking mental health care.
As you can see, Dr. Sayers is perfect for our podcast theme.
Dr. Sayers, can you tell us a little bit more about what kind of mental health issues occur with veterans that might be different from non-veterans? Is there any particular concerns or common struggles with reintegrating with society, or what do you tend to see?
Sure. It really spans the range. Veterans, just like all of us, have a range of issues. There certainly are very military service-related issues that are a lot more common. And those are the issues that most people think about when they think about the veterans' concerns. But it is important to understand that veterans' issues really span the range, just like all of us. But just to talk about those service-related kinds of things, certainly PTSD is very common for veterans who have served in a combat zone. And we started our work, as I said, way back in 2008, 2009, at the heels of two major conflicts that our nation was really heavily involved in at the time, Iraq and Afghanistan. So, we understood that there's going to be lots of folks coming to VA, and really had started coming to VA with combat trauma. And what resulting from that is certainly a lot of post-traumatic stress disorder and depression. and the secondary problems that occur from that as veterans really try to deal with those symptoms may increase alcohol intake to an unhealthy level or substance use. And so there's all those issues that are related to the combat trauma, in addition to the regular things that veterans, as all folks, have. So those were really the primary things that we were concerned about that are specific to the veteran population, or really quite predominant in the veteran population.
I would imagine it would be really difficult, unnerving, strange to come back into civilian life after what they've been through and be, steeped in society that has no idea what they're talking about, has never had these extreme experiences. What's that like for them?
Well, with some of them, it's really quite tough. In the VA, we work with veterans who, want to get care in VA, and many of them who come to us are not necessarily involved in employment. But we don't actually work in VA with most veterans who are transitioning from the service. One thing to say is that most veterans leave the service, may have some adjustment issues, but really do quite well. And so they're getting services that they need through employer-supplied insurance plans. So the veterans that we see are those often who either just choose to come to VA because of our expertise, or need VA care for their combat-related kinds of concerns. But to get specifically to your question about transition issues, aside from any combat trauma or PTSD related to that, there are lots of veterans who indeed do have difficulties with transitioning to civilian life. One thing that's really important to know about veterans is, or service members in general, is that they're involved in a system where there's always a mission. Service members are very mission driven. Even if they're not involved in a major combat deployment, the mission is training, or maybe it's a peacetime mission. But it's a kind of setting where service members are given orders, they faithfully complete those orders, and are very clear what the mission is. Leaving the service, a lot of veterans who have entered into military service very early in their life are faced, perhaps for the first time in their adult life, with not having a mission set out before them. So for some veterans, certainly not perhaps most of the veterans, but for some veterans, that's a very difficult transition. They've got to figure out, okay, what's my new mission in life? And so certainly a portion of the work that we do is to help veterans discover that new mission for themselves. And that's a struggle for them, and it's also a struggle that they share with their family members as they're working with that new phase in their life.
That's so interesting. I always think about the trauma, or, I always think about the extremes, like going overseas, seeing death and all of those experiences, and what that would be like to bring back to, people who have never experienced that before. But what you're describing is also just the basic structure of their life. They're very structured. It's very clear cut what to do, and there's a sense of purpose and a sense of unity. Whereas in civilian life, it's, who am I? What job do I? What am I going to wake up every day and do? And I imagine that's really difficult.
For some, sure, absolutely. It's a transition. It's a new thing to deal with.
Yeah, I have an unusual number of friends who are in the special forces, or in some cases still are, and it's a special case because they're actually, it seems like one of their problems coming back into civilian life is missing the sense of aliveness. They loved their military career, and but also a kind of strange fear or guilt that comes with, why did I like that? What does it say about me?
Yeah. There's something about potentially facing death or facing life-threatening circumstances that for a portion of service members really makes them feel absolutely attentive to every detail in life and quite alive. I worked with one veteran who happened to be a sniper, but involved in combat, really, he said to me that he never felt more alive than when he felt like bullets whizzing by. There was a sense of calm that overcame him, and intense awareness of every single thing in the environment. It was really quite amazing, and I think there's lots of us who might respond in that way because it's just an unusual circumstance which makes you absolutely attentive to moment detail as part of protecting your well-being. So it's I don't think it's that unusual, but it's really quite perplexing to a lot of veterans who don't understand why was that, in a sense, feeling so good, because they felt so alive. And the complementary problem is, after they leave that circumstance, nothing in life compares to it. Nothing in civilian life compares to it. And that's something that a lot of civilians just don't get. It leads to a sense of, for veterans, that I'm so different than most people out there because they just don't get that experience, or why it was important. And there's also a sense of pride in their service. They had a goal that was related to our broader sense of patriotism and protecting the U.S. So there's all that wrapped in that really helps a lot of veterans feel like, well, no one else in the civilian world really quite gets this the way I do. And so it's quite a difficult thing from that standpoint as well.
What kind of interpersonal problems do you see? I mean, it's when my special forces friends talk to me about their experience, I'm so aware of this total gap. Like, I will never, hopefully, from my perspective, like, I'll never experience something of that intensity in my life. I'll never have to make the kinds of decisions they made. And I'm thinking about it from their perspective, like, are they just so alone in this experience? How are there problems connecting with others who can't even, I can imagine their experience, but I'll never get there.
It's a big divide in experience, right? Yeah. And perspective.
Well, there's, it's part of the reason there's a great camaraderie amongst service members and veterans is that, I think just a mention of, I was in this conflict, or that was that, I was in this unit. It's an instant bond because they have a sense that the person that they're talking with can get where they're at. Whereas a veteran can describe these experiences to a civilian or non-veteran and never get the sense that that person can quite get it. Where there's that instant bond with a veteran, or they feel like it has had similar kinds of experiences. Although obviously veterans have in their military service have experienced, a wide variety of circumstances in combat or even in non-combat. But the general sense that, they sort of understand a whole different world that civilians will never understand is really quite comforting. And so there's quite an affinity amongst veterans. And you feel that working in VA, walking the halls, veterans greeting each other. They have their combat patches on, and they're connecting with each other, and they're the units that they served in on patches on their jacket. And so there's really quite a sense that we're one of the group of people who really serve this country in a way that many other people have not.
Is it difficult to come back to, for instance, a politically divided society, where a lot of people are against the combat that they've been serving in, a lot of people denigrating the military? Does any of that come up for them?
I don't think that's quite so common. I think what a lot of veterans who have served in combat are facing a lot more often are really inappropriate and intrusive questions about whether they had taken life or where they were. And veterans are really quite uncomfortable talking about this kind of thing. By and large, obviously they're each person is an individual, have different reactions. But that's really the most common kind of difficulty that that veterans will experience socially. There's also a sense that there's not an understanding of what the experience or the commitment was on the part of the service member. And so that civilians might just very blithely say, thank you for your service. And really, there's a sense from the veterans' standpoint, they really don't know quite what they're thanking me for. So there's a really, there's a sense that many veterans would just rather not hear that. Because it just seems a bit too simple for those in the civilian world just to simply thank a veteran for their service without a real understanding about what they're thanking them for.
That must be hard to come back from such an experience where they felt alive and felt and it was all consuming, and then to feel like misunderstood or not having other people besides for people in the military understanding their experience. Just simple feeling kind of a little bit of an outsider perspective. What is it like in the families when they come home and try to reintegrate with their families and loved ones back here? What happens?
Well, it's coming back from a combat deployment. I mean, the reactions are really quite diverse, as you might imagine, and a lot of it has to do with how the couple and the family managed that separation. So we've done some work in the past talking with veterans who've done really quite well in transitioning back from a combat deployment, and also those who had quite a challenge. And one of the things that we became aware of was those families, those couples who talked a bit about what to expect, what kind of communication they wanted to have during the combat deployment, and how they were going to arrange their lives to prepare for that deployment, in more than just a functional way about who's going to pay the bills. But really, how are we going to talk? What kind of details are we going to relate or not relate? Because there's a lot of challenges that deployed combat service members will experience in getting too much information from home or not enough information from home, and vice versa. So when those things are talked about and prepared for, the couple can manage those difficult conversations while they're separated, and manage that reunion a lot better as well. For example, one of the things that that couples will experience is that when the service member's deployed, everything in the household then is now on the spouse. They pay the bills, they manage the kids, they might even manage a move for the family. And so there's just many, many challenges. And there's a real sense of pride that spouses have at managing this really quite well on their own, or with only the support of their families and perhaps other spouses who are left behind. But by and large, really managing this well on their own. And so when service members return from a combat deployment, there's a sense of they don't have the same role as they did when they left. The spouse is managing it all. And if there's any issues that they're having in readjusting, there's a challenge that the service member has in figuring out, what am I supposed to do? What am I supposed to talk about, not talk about? How am I supposed to manage the kids? When do I start paying bills again, or making decisions? The spouses left behind might push back a bit on releasing the reins. And so there's those challenges about how to reintegrate one's role back in the family. And couples who know that that's coming can talk about that transition and deal with that directly with each other, when it's happening, really manage it quite well. It's just a normal transition that any couple who's separated is going to have, complicated by the uniqueness of a combat deployment. So there's a lot of complex issues that couples have to manage, and so those are just a hint about what kind of things that they're managing.
Yeah, it's almost like a double estrangement. They come back from this world where their life is so different, and then they come back into civilian life, maybe with trauma, and then they find themselves without a defined role, with a changed role, kind of wondering, what is my place even in this?
Yeah, and I guess in the military, your role is very defined, right? It's like you are in this position and doing that, and whereas, I guess, yeah, I can imagine that's hard.
Yeah. And it's also a challenge when, after deployment that lasts over a year, and the kids have developed and exhibiting new behaviors, and sometimes a bit more of a challenge because just of the stage that they're in. The service member might then return, and the attribution is made that the child might be struggling because of the absence of that service member, and it may just be a developmental shift that's occurring. The service member comes back and they've got a different child that they're facing, in a sense, because kids can develop so quickly. So there's many, many complex issues that couples are managing with that separation.
That does remind me, actually, that makes sense, because I had a patient whose father went away on military service, and it was around the time where she was about 10 or 11, and then he came back when she was like about 13, and it was just almost like having to reestablish a new relationship. Like, she was a child, and then she went through puberty with, her own sense of agency, and a little bit, she was kind of, getting a little spicier, a little bit like more independent, and so it was felt so different. And I know that they've struggled with reintroducing themselves to each other, like reestablishing this was daddy's girl versus like this almost grown woman kind of thing.
Yeah, absolutely.
In terms of the mental health issues, and you mentioned PTSD and other kind of struggles like that, and all the I'm sure associated problems too. I've heard substance abuse is a big problem. When you have already, we talk on this podcast a lot about how alienating that can be, just to have depression, just to have PTSD, and for the loved ones around you to have to try to understand what you're going through and manage the relationship. This sounds like even with that, even more of a divide in the experience. What kind of dynamics come up when it comes to family members, friends, and veterans struggling with mental health issues?
Sure. Well, there's at least a couple of facets of PTSD that are important, and how they play out within a couple and within a family. Certainly, one of the components of PTSD is this reactivity, emotional reactivity, and with that irritability at times. And that's the concern that is easier to identify and understand why that's a challenge. Might lead to a lot of conflict, may lead to some protectiveness on the part of the partner, of the kids. Spouses may not want the veteran to really affect the kids in terms of their irritability. And there's sort of some protectiveness, and there's challenges around that, since service members or veterans who are coming back home really don't want to be separated from their kids emotionally and behaviorally. But there are also some veterans who are really quite concerned about where their irritability may lead. Where they become, it's more often the worry is the biggest problem, as opposed to the actual behavior in terms of anger outbursts. And so there's a little bit, for some veterans in that situation, a bit of desire to withdraw, to limit the impact of their irritability or anger on their spouse, on their kids, etc. But one of the other, actually even more challenging symptom that has to do with PTSD is this sense of lack of emotional involvement or engagement. So you've got irritability on the one hand, but some veterans with or people with PTSD, you will acknowledge that they're not having the same range of other emotions as a component of PTSD. So there's a sense of that spouses get, and maybe even the kids, that the veteran's not emotionally engaged. And if you combine that with withdrawal from situations, what the partner is experiencing is a real disengagement after the initial reunion. And that's actually where the biggest concern is. There's lots of spouses who will tolerate, disagreements, arguments, a little bit increased conflict. But what's most distressing is when their partner disengages from them. And it's a little bit of a push and pull from the veteran and their partner, with the veteran maybe wanting to pull back a bit from interactions so that their irritability doesn't bother people, but the same sense that the partner wants them to re-engage, even if it's in a little bit more conflict. And so there's a push and pull there that a lot of couples will get into where these symptoms are prominent.
To kind of shift over into coaching into care, this angle of helping veterans actually get into, because there's so much here, and it is becoming immensely clear how family and friends have a role here, and also probably how they could use mental health services themselves. Mm-hmm. What do you have a sense of what the culture is around mental health in the military? Are there unique problems about getting veterans into mental health?
Well, I think it is important to say that service members and veterans, like all of us, really span the range in terms of our acceptance of mental health care. I think if there's any cultural difference, I think amongst service members and veterans, there's actually part of the ethos of a service member is that sense of self-reliance and duty. And you're given a job, you do it, and you do it largely without complaint. And you're part of a team, and your role is extremely important. So to reach out for help and to acknowledge a sense that, well, maybe I'm not doing this well and I need someone to help me, is really one of those beliefs that is a trained-in belief in the military, which is at times hard to counter. So if there's any cultural influence, we certainly see that. But it is important to say that there's lots of veterans that we see who are really quite willing to seek help and may do so even while they're in the service. But there's certainly some who are resistant for those reasons as well. And maybe that's just the attitude that they came into the military with. In the broader population, all of us at times are kind of resistant to the idea that we may really benefit from seeing a counselor or psychiatrist or whomever. That's just a tough decision for most of us. So there's it's really quite diverse and heterogeneous as to how people react. But those are some of the unique things having to do with service members.
And what is it like for, I'm sure that, with that disengagement, the kind of trouble reintegrating and finding their roles, that there must be a point where family members or friends might say, okay, I think this person might need mental health treatment, or they might need help, or we need help. What happens around that? Especially if there's, some reluctance, or might be difficult to go ahead and find mental health treatment themselves. Like, how can families support a veteran in finding that kind of help?
Sure. One of the most common things that we hear about when family members of veterans call us is that they're at times feel like kind of at the end of their rope. They've had a series of very difficult, challenging discussions with the veteran that at times are a result of, our family member callers saying to the veteran, listen, you really need to see somebody. Now, when this comment comes out of a conflict, then that's not the context in which that kind of statement is at all helpful. And, our callers have at times had a series of these kinds of discussions that have escalated from, advice to, a strong command to an absolute ultimatum. And now I know a lot of this is really driven by a lot of concern by family members. They don't want the veteran in their lives to be hurting. They don't want their family to be hurting because of the concerns that that the veteran is having and that they're experiencing in their family. So it's really coming from a good place, but the implementation is really where the challenge is. So that's, when family members call us, we hear a lot of times that they've had a series of very challenging and unsuccessful discussions, and they really feel quite hopeless about, what do I do? I just, can you call the veteran and tell them that they need to get care? And we don't actually contact veterans directly. Obviously, that would be an unwelcome call. So our work is in really helping shift around that approach from being a critical sounding demand to more of a supportive kind of conversation. And that actually is where the work occurs. It does take some, like a series of calls to kind of help the person really address their own approach and have more successful conversations.
How would that conversation go? I mean, so say it's been really difficult. How do you choose the time to talk? What kinds of things are helpful to say?
Sure. It's really a series of steps. The first step often is really helping the family member see that they actually have a great deal more influence than they believe that they have. They really have experienced pushback quite a bit in this conversation, so that they get a sense that nothing I say will ever do any good. So therefore, something else has to be done. So our first task is to really underscore just how important the person is to the veteran in their lives. That's step number one. And right along with that is the idea that, if you're taking an approach that isn't working, the next thing to do is to simply stop trying to take that approach. Let's think about what an approach actually might work a bit better. But the first and best thing you can actually do is to simply stop trying to have that conversation. And they respond with, well, what if the veteran never brings up anything? I said, well, trust us here. This is a process, but the first thing is to stop doing the thing which actually gets a negative response. And further phases are really about trying to have conversations and activities that are positive. So you really try to shift their experience that they have with the veteran from day to day to things that are not about, is the veteran going to call the VA or a counselor, or are they not? It's no longer our interaction is going to be solely about that. So you're saying, let's think about the kinds of things that you can do with the veteran that are enjoyable, that are about something else. And the later phases, and you really have to kind of lay this out so that they see there's a good end to this. And that is, you're really trying to help the family member become a better listener and less of trying to play a role where they're advice giving and being very directive. The approach we take really rests on the idea that all of us like to make our own choices. None of us like to be told what to do. So it's very simple. And once we really describe that, okay, no one wants to be really commanded or told what to do, but that within each person we have a desire to be happier. And what you're doing with the family member is really trying to help the veteran feel comfortable enough to disclose when they're distressed, and to be a supportive ear, not an advice-giving one. You help them have the kind of conversation where it's less about, this is what you should do, and more of, I like to hear you talk about what's important to you when you're distressed, and you tell me, what do you think you should do? What do you think are your options? And so you're inviting, what we're coaching the family member to do is to invite the veteran to talk about what their choices are. And so you're really helping the family member prompt a very normal and positive process that most of us have to try to better our lives. And so it's less about trying to defend one's autonomy and pushing back from the veteran standpoint, and more of, oh, I need to fully focus on what are my choices? How do I feel better? What do I do? And the last thing is really to help the family member articulate very clearly, listen, I'm here if you need me. If you need me to help you explore one of those avenues, just let me know. But it's your choice. And so you're really trying to get the family member to acknowledge the fact that everyone actually is free to make their own choices. So you're not actually having them signal something that isn't true. You're just acknowledging the reality. It is your choice. And that actually can be quite freeing to have that kind of conversation. So the veteran is no longer focused on resisting the pressure, and they're more focused on, what do I want to do? What can I do? And that's the kind of process that you're helping the family member help the veteran get into. Does that make sense?
Yeah, I love that. I think that approach is helpful in a lot of different contexts, not just with veteran populations. That's wonderful. Giving the agency and support, right? I think that you're right that it sounds like people jump into the advice giving. You should go to treatment. You should get a therapist. You should do this as a way to try to help that person, but ultimately is not as effective as, I'm here to support you and let's explore what you need. But I'm also, as you were talking, I was thinking about, what happens if the stakes are higher? What if that person is at risk of harming themselves? They have suicidality, self-harm, or they are, thinking about hurting someone else, and, and the family members get very scared, right? Those are higher stakes where that more supportive but hands-off approach might seem scarier to do. What would they do then?
Sure. Well, in our role with family member callers, the first thing that we do is to get a sense from the family member what the level of concern is and how immediate the threat is. So we're asking them, what does the veteran say? What kind of lethal means do they have available to them? Do they have a gun? Do they have medication? What have they done to signal that they're in this phase of, preparing for death? So people who are making plans for suicide often will talk about, when they're gone, what they want people to do with their things. They might be giving away some of their possessions, might be talking about there's nowhere to go, or they feel alone or unsupported. And so we really try to help family members become good observers of all these things. And so if the threat is imminent, what we do is we do a 3-way call with a veterans crisis line. They will talk to the staff member at the crisis line will talk to the caller with us on the line about what is specifically going on. So they're the experts at really trying to figure out whether it's a crisis worth intervention. And there's a number of things that the crisis line can do in those immediate risk kinds of situations, including a rescue, including, getting emergency personnel there, et cetera. So for us, that's a very rare circumstance, but it has happened for sure. But most often, we're really talking about helping family members be comfortable in asking more directly of the veteran, listen, I'm hearing you say how hopeless things feel to you, and I want to know whether you've thought about hurting yourself or ending your life. And so you want to normalize that question is really quite an important one to ask directly. And our role is also to educate the family member about, okay, what's the next step if the veteran indeed says, I really am having those thoughts, and help them, figure out how to get to the crisis line and to those more emergency kinds of services.
What would you say is sort of general advice for friends and family if they have a veteran coming home? I know you said it can feel really odd to ask them certain questions. It can feel incredibly invasive. So what kinds of things should we avoid saying or doing, and then what kinds of things can we do to help?
As family members or friends of veterans, I think the things to focus on are all the skills that, about being a good listener. So you're asking open-ended questions. You really seem quite upset about some of the things that happened. Would you like to tell me a little bit about it? Or when you're ready, I'm all ears. Or, let me know if you want to bend my ear about this a bit. And also it's important, as I was talking about earlier, about avoiding the more directive kinds of responses, things that sound judgmental or idea that this is something you need to do or you should do with that concern. So there's really avoiding those kinds of statements as well. But really just acknowledging this is painful. What you're experiencing is certainly understandable why it's so painful. Is there something that I can do to help with that? Have you thought about what it is that you would like to do about how painful this is? So those are the more sort of inquiry-based kinds of questions that are open-ended that are actually really quite helpful. And not shrinking from the conversation, not reacting overly to what's being said, but just really offering to be of help if they'd like it.
So, and tell us a little bit more about those next steps. What kind of services does the VA system provide for family members and friends or the veterans themselves? I'm very new to that, so I always just think of it as 911. But your program, Coaching into Care. Can you tell us more about the different Coaching into Care or the different kinds of services that
Sure.
they could look into?
Sure. Yeah, it's a real range. Obviously, individual treatments for the veteran and spouses, other family members can be invited to be part of those sessions. That can be really quite helpful, particularly in the treatment of PTSD. There might be specific procedures that the therapist is really having the veteran do to manage their PTSD or to reduce their PTSD symptoms that it's very important that the family member know about. So simply being part of individual sessions is something that we encourage here in VA. There's also couples counseling that is offered in VA at major facilities, at vet centers. And so that's another very helpful service that is really quite available. We're seeing currently, and this time in the pandemic, a real increase in requests for couple therapy because it's just a time that's been very challenging for many, many families. Some of the other services, particularly at vet centers, are educational kinds of services for spouses around managing, helping a veteran manage their PTSD symptoms, and some education about what is PTSD. So those kinds of services are available actually quite frequently at vet centers, which are separate than the medical facilities, but they're really kind of counseling centers for combat veterans.
And what would you say about individual treatment for spouses of or other family members of veterans?
Sure. There's family members who have, spouses who will call Coaching into Care with their own mental health needs. And at times with when the veteran is really reluctant to seek care and the family, the family member caller, often the spouse, has their own needs, it may be just a good thing for them to get treatment themselves. It's a good example of moving forward in one's life by getting mental health treatment. Now, if it's specifically a spouse of a veteran who is part of the caregiver program, there are services available within VA often with that for that spouse. But that's a particular program with veterans who have a service-connected disability at a high level. That's certainly a smaller slice of the veteran treatment population. Our role in Coaching into Care for spouses who need treatment and are not eligible for services in VA often is to help that spouse or other family member find services in the community. So we have directories of services that we can tap in lots of communities throughout the whole nation. And sometimes it's coaching them as to how they go about tapping benefits that their family may have, and how to seek those services and supporting them through that. So that's another service that Coaching into Care will provide, is helping that spouse or other family member seek care outside the VA system.
That's fabulous. I get so many questions, on Instagram about how to find a therapist. When we ask people what they want to hear about, it's how do I find the right therapist? So, and it's a recognized problem that it's not easy, and it's not a straightforward, question. So that's great that you offer that help.
Sure.
Kibby, any last questions?
Yeah, if there's any resources you want to mention, we'll post whatever resources and links and everything that you like up on the website. But I was wondering if there's anything you wanted to share with our listeners now in terms of first point of contact, a website, or something to a book, or anything that any resource that they could reach out to if they want to learn a little bit more or want to seek help.
Sure. Perhaps the easiest way to find is to do a search on the web for Coaching into Care. That's INTO, Coaching into Care, and we'll pop right up. Our toll-free number is 888-823-7458, and we answer the phone directly from 8 a.m. to 8 p.m. Eastern Time during Monday to Friday, normal business hours, but extending to 8 p.m. Eastern Time. So those on the West Coast can reach us a little bit better during those evening hours. But when we're not available, weekends or later evening, people can leave a message, and we will try to reach people the next business day. So that's how to reach us.
Perfect. Well, thank you so much again for coming on our podcast. This was really helpful, and I learned a lot, and I'm really grateful that you brought this lens of the family and friends as well and how they can help. So thank you again.
Well, I'm happy to be here. Thanks for asking me.
By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval.